Before the show starts, again, just like to say a big thank you to the sponsors, Air Canada Cargo, ATC Aviation, Bombelli, Cool Dolly and Cool Storage Solution, Etihad Cargo, and Sarco Airport Equipment. Thank you all so much. Ladies and gentlemen, friends, colleagues and listeners, welcome again. We've got another session now of the Pharma Digital event, and I've got two great guests joining me. So firstly, I've got Samuel Speltdoorn, which means a lot to me, Samuel Speltdoorn. And Samuel is the Cargo Business Development Manager, Product and Route Development for Brussels Airport Company. So welcome on board, Samuel.
Thank you, Chris.
Really appreciate it. People will be thinking what's going on with Speltdoorn now, but maybe we'll cover that later on.
Yeah.
And then also joining Samuel, we've got Rajan Chalaba, and thank you very much, Rajan. And Rajan is the General Manager, UAE and the Kingdom of Saudi Arabia with TRIDENT Freight. So welcome on board, gents. Really appreciate it.
Thank you.
Now, lads, just to get you warmed up and to give everybody a little insight, if you wouldn't mind, can each of you just tell us a little bit about what you do with your respective organization and what has the last 6 to 9 months of this pandemic meant for you? What have you learned as a result? So maybe we start with you, Samuel.
Thank you, Chris. So yes, I'm the Cargo Business Development Manager for Brussels Airport Company. We have a fully dedicated cargo team. I report into Nathan de Valk, and then he reports into the well-known Steven Polmans.
Yep.
The rock star. One of the reasons I joined the company is because of Steven and Nathan. I've been following them for quite a while in my previous career. I'm responsible for the pharmaceutical segment at Brussels Airport. So I joined the company 2 weeks before the lockdown started in Belgium. Previously, I worked at Virgin Atlantic Cargo for 4 years. So I lived in London prior to that. Hence, the name rings a bell with you, Chris, Speltdoorn, the district near Heathrow. So yeah, I moved just before the lockdown. It's not easy to join a new company, but it's a really great team here at Brussels.
Yeah.
We've been working tirelessly. A lot of work has been done in the past 6 months. During the lockdown, we worked from home, but we're also in the office. I'm currently in the office. And actually, air cargo has been doing really well in Brussels. We have seen positive growth this year. We have not been sitting still. We've seen a lot of PAX freighters arrive. We have seen new airlines, new freighter airlines as well. So yeah, it's been really hectic. And now we've been working a lot, both internationally and locally as well, on the upcoming COVID-19 vaccine. But I'm sure you'll talk more in depth on that later.
Yep. Welcome on board. And just for anybody who's listening and thinking about Speltdoorn, it's unusual that somebody has a surname and then they lived in the same place. And I played football for Speltdoorn many years ago. So that's the coincidence there. Lovely to see you. You put some great memories back in my head in those few seconds. So brilliant. Now, Rajan, if you can just give us a similar introduction, please.
Sure. Thank you, Chris. I'm Rajan. I'm General Manager for TRIDENT Freight, representing UAE and Saudi Arabia. Well, I'm in the industry for the past 40 years, mainly from the air freight industry. But in Dubai, we do all the modes of transport and logistics for customers. For the past 20 or a little over 20 years, we are very actively involved in the pharma transportation by air, ocean, and overland. And we have been going through all the procedures, implementations within Dubai Port, customs authorities, the Ministry of Health, all that. So we've been part of all the procedures. So that help us to meet customer needs. And well, expertise, we have trained people. You mentioned about CE and other qualifications, validations being done. So we are part of it. We are not yet CE, but we are into. But otherwise, we have all the equipments certified, procedures, etc. for our day-to-day operations. For the past, we also have in-house within the group a logistics center for handling only pharma under the name of Tri-Pharma Logistics. So that support the warehousing need and distribution need of customers. For the past few months, yes, it's been tough, but UAE has classified our industry as under the vital sector. So we are exempted from all the restrictions at a certain level. So from May 27 onwards, we are in full swing. So we are not that way affected in the operation side. But yes, from the commercial point of view, yes, we are affected by 15-20% because the customers are not, not working actually. They are working remotely or otherwise. So otherwise, we are not affected operationally. We are working with full swing, but strictly by following all the norms implemented by the government authorities.
All right, sir. Good, good. So now we all know each other. That's great. Now, Samuel, big question here for you. Okay, now cargo and the supply chain logistics has really now started to become at the forefront of everybody's attention. People who never even spoke about it are now asking questions. They're very interested, which is a great thing. But obviously the eyes of the world are on supply chain logistics, are on all of us to make sure that something with such a high profile as these vaccines has no spoilage. Okay, now you yourself and your colleagues, you were visited just recently by members of the media. Do you want to just tell us exactly what that was and why?
Yeah. So yeah, we had the media over. We also had our Prime Minister over at the airport this week. The airport is coming in. Well, global airports are coming in the media as both negative and positive news. Negative is that the passenger numbers are still dreadfully low, and the airports are suffering. Airlines as well. But also positively on cargo, we are seeing at Brussels a positive growth. We have been seeing a lot of new customers, as mentioned before, but also with the upcoming vaccine that needs to be transported by air globally because the productions are not in every country in the world. We have a lot of production, pharmaceutical production in Belgium. We have Pfizer is here, GSK is here, and other companies as well. By numbers, we are the second largest exporting country by air freights for vaccines. Third largest in production as well and research. So there's a lot of pressure because these vaccines need to go to the US, to the Middle East, to Asia as well. And we really want to profile ourselves as in the past as a preferred pharma gateway here at Brussels Airport to elaborate this and help spread the vaccine globally to get rid of this virus.
Good, good. Now, as far as the media visit, did you find that it was, part obviously for fact finding, part was just to get an understanding as to how well prepared, because, there's been a lot of talk about the industry maybe not being as prepared as possible. But to be fair to everybody in the industry, we don't know what we don't know. And there's a lot of information that still hasn't come out, and it won't come out until people are very, very, very sure, because they don't want to make any public mistakes. So as far as that credibility is concerned, how did you feel the visit went?
I think the visit went really well. I joined the team in February, and people think that we have done a lot of hard work. We have worked a lot, but I've really felt that Brussels Airport was already really well prepared for the moving of pharmaceutical products. This is a legacy from Nathan and Steven. They've been working tirelessly the past decades on implementing CEIV, on updating the infrastructure. We have 30,000 square meters of first line and second line cold storage capacity, which is it's really big. It's amazing. We've now also finished Rue Cargo West. It's a new product, new site here at Brussels Airport, where we have Koenenagel, Expeditors, and WFS on first line, right next to the air sites. And yes, the media is really interested in how will we accommodate this product, this really sensitive products. And they're really interested. We've seen a lot of coverage, as you mentioned, in the last 2 weeks. And yeah, we show them a few facilities on how we are preparing. We're also preparing with the local task force, in which I can elaborate a bit more later. But through this media, we also get a lot of attention. And it's important that we just don't sell fake stories. It puts a lot of pressure on us, but we're really confident that we can move this vaccine on a robust and transparent logistical platform here at Brussels Airport.
Brilliant. Well done. I'm convinced. We'll get back to that. We'll get back to that later. Now, Rajan, you've been involved in pharma for many years.
Yeah.
Now, with the introduction, and it's been great. Every single Monday we've been getting good news, more news, and people being so used to bad news, you can almost see that when they get good news, they still try and put a twist on it and challenge for more bad news. You know, so they're saying yes, but and why and everything else. But with the fact that the first announcement from Pfizer, and then the the really challenging temperature ranges that have to be stored, then the next Monday we get Moderna with an even better option, and now we've got Oxford and AstraZeneca with a more shall we say easier to handle, more normal handling criteria. Now that's going to allow for the whole world now to start to see that they can start to make certain selections based on the capability of their infrastructures, and also from a cost perspective, which is great. Now, on top of that, we've also got Sinovac and we've got Sputnik 5 that have already started to be transported. So there's going to be more as well. So there's going to be huge variety of the vaccines being distributed. Now, from your perspective, Rajan, if you can just explain to us, pharma and vaccines is not unusual within our industry. So if you can just put your perspective on that.
Sure. Well, pharma, it has different, handling structures, handling regimes, and vaccines particularly is very limited, I would say. If you talk about vaccine, we have come across two temperature regime. One is -70 and the other one is +2 to 8. This is what we have so far heard in Dubai. And there are multiple manufacturers going to put their stock in Dubai. Using various providers. That can be the Emirates Sky Cargo, the GHA Donata, it can be the 3PL pharma companies, the manufacturer facilities. It's going to all the facilities. Only then it'll become sufficient for handling the volume which we expect in the next few months. So I would say that handling is not a problem, but the operators or the manufacturers have to make available the necessary equipments or the containers. Particularly to transport under the -70-degree conditions. There will be small units. We currently do for genes and vaccines. There are small units, special units that's being used for transportation, and there are also transit cargoes, and there must be requirement of, I would say, re-icing and maintenance, etc. So the operator should be really prepared to handle this all the way until it is delivered. So pharma is different. I mean, it's large volume, so in large packages rather. So it is easy to handle. The only challenge in both the cases is maintenance of temperature. So temperature maintenance in this part of the world is very challenging. What we have seen is even though the customers have accepted to load in environators or the temperature control units of various companies, SkyCell, etc. There are still cargoes going without such passive packaging. So we have seen challenges. -2 hours to flight departure, and after arrival 2 hours until it is delivered to the temperature control areas. So these 4 hours are very crucial for maintaining temperature. And so far the carriers or the operators have found no solution yet, I would say. There are certain operators or airlines, I would say they have some solution by deploying some units in the tarmac. But otherwise, we have seen the temperature touching 60 degrees and above. So this is a challenge for the customers and the operators, companies like us, to convince customers. So otherwise, we don't see a challenge at all.
Okay, all right, very good. Thank you very much for that. Now, with regard to something you said earlier, Samuel, with regards to task forces, okay? Now, I think some of the words that people are going to not want to use after we get through this COVID is they're not going to want to use unprecedented anymore. They'll probably be fed up of using the word task force, and another word will be collaboration. So God forbid anybody in the future who says unprecedented task force collaboration, they'll be you know, they'll probably have things thrown at them. Now, everybody says that these words, you know, that they're words, but behind it, there is an awful lot of sense and purpose. So with regards to your task force, okay, and like I said, there are so many governments, carriers, airports, GHAs, regulators, representative bodies, charter brokers, LCCs, private aviation, last mile providers, facilities, 3PLs, everybody has got a task force. What has made your task force so successful in Brussels?
Yeah. So one of your questions that I've received by mail is who provides the oversight guidelines for pharmaceuticals, especially the COVID-19 vaccine. And that's been a bit the issue. There is no authority at the moment saying you have to do this and that. So we've been working closely together with IATA, but also with Pharma.iro and TIACA.
Yep.
Pharma.iro and TIACA have jointly started the Project Sunrays task force.
Yep.
Sorry for using the word task force.
No, you're okay at the moment. It'll be something in the future.
Yeah. And Brussels Airport is also actively involved in there. So the target there is to speak directly to the pharma shippers who are manufacturing and researching the COVID-19 vaccines, and try to get as much information as possible that can be shared and then share it in the group. And also by the end of December, provide an industry white paper that the industry can use towards the handling of the vaccine. So directly being involved in that task force, we then vertically communicate that information to our local people. And that's why we also started our local task force, the Procure Task Force, in which we have 4 main key working packages, of which the first one is, like I mentioned earlier, is the shipper requirements. So we have a lot of sources. Project Sunrays is one of them. We also have direct calls with the Belgian pharmaceutical producers. We also work together with knowledge institutions like the University of Antwerp, which has transport economics, and also virologists that are, again, in direct contact with the pharma producers. And just to combine all that information and then release it towards the public, because here at the airport, a lot of companies, including ourselves, we in the beginning had no idea what was waiting for us. We also have a pharma shippers forum where we want to get all the shippers together with us and then listen and speak to them and get their advice. Then we're also looking at a capacity work package. Capacity is a big topic as well in the media. We want to map our local cold chain capacity. It's big, but we want to get the exact numbers to see what can be done, if it's upgradable, if it's segregated, etc. How much import, how much export. We're putting a lot of focus on our airside pharma transporters. It's been a lot of noise around the airside pharma transporters. The shippers really want to get a fully closed cold chain towards the aircraft. So we make them available to everyone here at the airport for free. We want to speed up those processes to get the contracts, etc. with the airport. Then we have 2 really important working packages. One is the SOP working package, where we want to not create a new SOP, not from scratch, but just look at existing SOPs, and then provide guidelines from all that information we gather from local and international task forces, and then tailor-made it for the COVID-19 vaccine. We have our partner Air Cargo Belgium working really actively on that, and then together with the 4th working package, with the digital one, we want to offer a digital solution to offer full transparency towards the shippers on the local level. So every milestone here at Blue Cargo is logged and monitored for the shipper, so they have full visibility on the move of their vaccine throughout Brussels Airport. And it's a lot of work. We have weekly working groups, but it's really fun as well to work together as an industry during these times that everyone is working from home. It's great to be in touch with them, although it's virtually. But it's a good way to get everyone involved and keep in touch as well. But
it's great. It's great the way everybody's opening up and becoming more, more transparent and more free with that transparency. And the data is good for everybody.
Exactly. Yeah.
All right. Well, I'll come back to that in a minute. And obviously, you're chairman of Brew Cure, yeah?
Yeah, correct.
Yep. We'll come back to that. I'm sure you've had a few challenges. Now, Rajan,
Yeah.
and we're talking about now choices. Okay. So now you've been in the game for a long time, and obviously you're well used to, especially the countries that you work closely with. You're used to these extreme temperatures.
Yep.
When you get instructions from the farmer and whoever the shipper is, with your choice of who is going to be handling it from a carrier perspective, and then who they choose as far as the ground handler, either at origin or destination, what sort of criteria do you place as being really important?
Sure. Well, here in Dubai, or for the region, we always prefer Emirates Airline, Emirates Sky Cargo as a first preference. The carriers also knows Emirates and its capabilities. Emirates has the GSTP certified warehouse called I module in the Dubai Mega Terminal.
Yep.
It's an excellent facility. It has all the infrastructure to handle pharmaceuticals of all nature or vaccines of all nature at the moment. They are ready. And their sister company, Danata, which is a GHA for the other airlines other than Emirates. So they also have a fantastic facility for holding and handling pharmaceuticals of different temperature nature. These are the airline and the GHA together at Dubai Airport. And the second choice will be if Emirates cannot deliver to a particular destination, we look for other solutions. So it will be Etihad. So the Abu Dhabi customers always prefer to use a direct carrier, which is Etihad. It's closer to the city, and Dubai prefer Emirates. But still, when situation demands, we also deliver to Abu Dhabi Airport by using a reefer truck, to Abu Dhabi Airport to catch next flight. So that's not a problem. So these are the two main carriers. If these two cannot, then we go to other carriers for an indirect solution. So which is second priority for the customers. It's mainly not that they are against those carriers, but it's mainly to control the temperature requirements. They fear that in transit it can go wrong, or it can vary, so that will affect the quality of the product. And at the destination, I would say that some destinations we are quite confident with their capabilities, facilities, but there are certain destinations I don't want to name. They have challenges with the space and controlling, the required temperature. So for those destinations, we always advise customers to have a pre-arrangement done for permits and clearances so that they can keep their vehicles ready, pre-cooled to take delivery on arrival. So within few hours of flight arrival, they take direct delivery into their truck, which we used to do in Dubai in the early 2000s. So we used to pre-cool the truck and keep ready to take direct delivery and then do the process. Now things have changed. It's become better equipped and infrastructure-wise. So we are going through the normal procedures of channeling the shipments. But these are the challenges we face with, and this is a procedure we follow to select carriers and handling agents, both at origin and at destination. Even at transit points, sometimes we use our partners or officers to ensure that the temperature is looked at, and if there is a requirement of re-icing, then they attend to re-icing or things like that. So we get an update on that. We also monitor, like Samuel mentioned, we also monitor the shipments and update the records for the customers, so they get a timely update. There will be also tracking being done. So digital tracking is deployed by the customers, which we follow to monitor and then update them.
Okay, very good, very good. So, it's a very robust foundation that was already in place, and now what everybody's doing is just tweaking it and making sure that all the risks are mitigated. Absolutely. And any bottlenecks are managed correctly. So thanks very much for that, Rajan. Now, Rajan mentions trucks, Samuel. So correct me if I'm wrong, but I'm sure with your studies, with regards to Belgium, to Brussels, to all neighbouring countries, Europe, in fact, I mean, people have always been assuming now that everything's just going to be piled onto aircraft. Well, it's not. There's going to be road feeder services that are going to distribute an awful lot within Europe. So that's obviously going to take away some of the problems. What's your estimate there? Because obviously from an export side, you'll be dealing with it, but from a road transport perspective, you're also going to be heavily involved?
Well, the first volumes we expect, of course, will be exports. We have a lot of production here in Belgium, so import won't be happening in the first stages through Brussels Airport. The road feeder service is correct for local travel around Belgium for the vaccine. That will be by truck, but we also expect the integrators to play a part in this.
Yep.
Between the different hubs they have here in Europe. Again, the vaccine stability data is yet too early to allow longer trucking service, so they will have to be very careful. The shippers will put temperature loggers, live loggers into their shipments for sure. So they will be monitored constantly. But from a road feeder perspective, we do expect a lot of traffic to be going through Brussels and other areas in Europe as well. Yes.
Okay, and the fact that you mentioned there again the integrators, I think one of the biggest challenges that people are concerned about, or influences their choice of who they use, is the last mile delivery.
Yeah.
Yeah, and hence the integrators and specialists who are probably going to be getting involved in the very first tranches of vaccine distribution.
Correct. Yeah.
Yeah. Okay. Now, Rajan, with regards to last mile, obviously you get involved in that an awful lot, which is something that's had the spotlight on it as well, especially in some of the warmer climate and extreme climate locations. How is the last milers? How are they coming together with these task forces and offering services and making sure that they're able to deliver?
Well, the deliveries to the hospitals or pharmacies, etc., will be by deploying vans, certified vans for pharma or vaccines. Currently, there are many operators, including Emirates. They have introduced last mile. So that will not be a challenge. Deploying of bikes, etc., is something to be known yet. We haven't heard so far, but maybe DHL and other integrators are looking into it. But currently, we have seen the smallest unit is the van, the small vans. Otherwise, it can go if it's a large volume. We have different types of trucks, so that can be deployed to deliver.
Okay. And when you make your choices, do you get involved with some of the last milers and their capabilities? Do you do any audits or risk assessments on their capability?
Sure. For all the suppliers we use, maybe Emirates or the NATA or other airlines, we do an audit. Even customers come with us for an audit on them. So we do a validation. Only then they are selected for use.
Okay.
And for all their capabilities, procedures, etc.
Okay. And just picking out Saudi, I've had the pleasure of living and working in Saudi for Saudi Cargo and also for Nakel. How is it being seen? When you're looking at making choices for Saudi.
Well, Saudi, we don't have our own facility. We have a contracted facility with whom we also have an arrangement in Dubai. So we will use their capabilities for storage, if any, and distribution by using their trucks and other contracted trucks. Of course, we will be doing an audit and a supply evaluation process, which we will do before selecting them. The process is on, so we expect that to be ready within the first quarter, early next quarter, I would say.
Okay, very good, very good. Now,
and it will be covering Riyadh and Jeddah primarily, and Dammam is when required.
Okay, very good, very good. Now, for both of you, with regards to people and understanding why. Okay, so within our industry, everybody's aware of the focus that's put on security and safety, and that's normally because it can harm us whilst we're working on the ramp or around the aircraft or with cargo, etc. But now with pharma and vaccines, it's more to appreciate that if you do something to it, it can affect somebody else. So the understanding and the appreciation and the mindset and the training, have you seen that taken on a new dimension and people focusing on the level of training and awareness and understanding why? Because, if one thing has been sure, this COVID, it's the empathy that's there from one person to another and the care is one of the good things that's happened. So, Samuel?
Well, here at Brussels, our company strategy has always been CEIV. So in the past decade, we've really invested heavily in this and worked closely with IATA. We're the first and largest airport community in the world to be almost fully CEIV certified. So to look at the COVID vaccine, we build upon CEIV for this. Our people are trained here locally. They have the pharma awareness training and all the certification that's needed. So the handling of the vaccine is already been worked on in the past few years. The handling will be very secure and very strict. So we do expect that this will continue like we've been doing, like we've positioned ourselves in the past already as a preferred pharma gateway. And this has helped us as well in the last few years to get double-digit growth as well. So to answer your question, we will really work along and build upon the CEIV standards here at Brussels.
Okay, very good, very good. And are you seeing like, obviously you've had your community platform and you've been very proactive with data sharing. Are you seeing it making a big difference now? And once people can see that turning point, they get very enthusiastic and engaged with also being transparent?
Yeah, it really helped us in the preparation for the move of this vaccine. We are now looking to further expand that by looking into a fully software solution that now gets completely rid of the fragmented industry in the air cargo industry. And this is our way forward, to offer full transparency towards the shippers. And this will not only benefit us in the short term for the COVID-19 vaccine, but in the longer term for pharmaceuticals in general that go through Brussels Airport, because we can't just put focus on the COVID-19 vaccine alone. There's still really critical vaccines and clinical trials passing through the airport, such as cancer treatments, etc. We can't just ethically allow the COVID-19 vaccine to take full priority. We also have to still look at other diseases and other vaccines and cures to pass safely and correctly through the airports. Exactly,
and a very, very, very good point. Now, Rajan, extending on that particular point of view, obviously everybody's focusing on vaccines. Samuel's just said, there's other things that have to be done, and every country's press is talking about the pressures that are being put on hospitals, but also the pressure on other diseases and illnesses and the longer term effect of those not being treated. In our industry now, we've got a reduced capacity because of the passenger issue. So we've got reduced cargo capacity. Even with the freighters, we've still got a reduced capacity. So from your perspective, Rajan, are you confident that the capacity uptake will be maintained and that, pulling together and maybe people bringing more aircraft out of mothballs and getting them prepared for the freighter versions, that the supply chain distribution will still be maintained?
Yes, Dubai is always known for capacity in delivering whatever is required because it's the transit hub. So the government does not compromise on providing capacity in any area. So we expect that the airlines will be supporting with the capacity for distributing to the region. It's a vast region, EMEA, so there will be added capacity by the carriers. I'm sure it's already in the making, but so far we haven't heard further on an update.
Okay, thank you.
On the capacity. On the training, you mentioned about training. Yes, training is very critical. The procedures are very critical and we don't compromise, and nobody compromise in this industry, whether operators or 3PL or freight forwarders. So the SEAV program is something new in this part of the world. That is, we're trying to accept and implement. Mainly for operators, air operators or other GHAs. But we look at other training programs, Air Pharma and internal training. So we integrate our procedures with the manufacturers and the operators, and there will be also multi-operator procedures. And so So with all these in place, the teams are well trained in all the service providers. So this is a concept working well in this part of the world. So the multi-operator process is working pretty well. So that helped the customers to reach their products, in their required quality level.
Yeah, no, very good. I think it's one of the most important messages is, the industry that we work in and we love. It's a very, very capable, very structured, very regulated, very disciplined, and very, very capable of dealing with these particular challenges.
Yeah,
So,
exactly.
well endorsed there, Rajan. Now, Samuel, another area that people tend not to focus on from the outside, but we do from the inside out, is security of sensitive shipments, of high value shipments, etc. So the security element is something that has to be taken on board as well. So that's another degree of audit and verification that needs to be put into place. What have you guys done about that, or are you just following normal practices?
Well, the industry is already well prepared on a security level. It's one of the reasons that we get high valuable shipments through air transport naturally. But what we do hear from the shippers is that correctly security is key to avoid counterfeits and theft. It will be a very high valuable product. Will be the product launch of the year, as mentioned by press and the media. Yeah. And we do expect by demand from the shipper that companies will probably have to contract private security companies to monitor and secure the premises whilst the vaccines are being stored temporarily at the freight forwarder or the ground handling facilities. Yes.
Yeah. And people have been practicing TAPA and all sorts of security programs for a long time. So again, everybody should be very confident that it will be handled correctly. It's a shame, Samuel, what you mentioned there about counterfeit products. So whether that comes with syringes or any other parts, or even vaccine itself, it's such a shame that that people would go to those lengths, especially at these terrible times. So please God, touch wood, that won't happen.
Exactly.
Awful. Rajan, can I ask you, from your perspective now of taking the trust from the shipper and making choices thereafter, what would you like to see change in our industry as a result of the experiences that have been held now from this last 8 to 9 months and the next probably 5 to 6 months ahead of us? What sort of permanent changes would you like to see happen within the industry?
Well, we touched about it a while ago. We don't have to invent new procedures unless it is really demands. The existing procedures are good enough, out to 95%, I would say, or more than that. Strict implementation of procedure is very important. I would say that it's been driven on high level and mid level, but onto the ground level, we see there are some areas which require real attention. So if this is plucked, we see that many issues will be resolved, and we will have less irregularities, I would say.
Okay, all right. And what about the use of like there's so many good products, from active, passive containers to the various boxes. You mentioned earlier about blankets. There's so many good products. Do you see them developing further now as there's more emphasis on the pharma side of the business?
For sure, there are new products being manufactured and being put on practices. So we do that on a day-to-day basis. So we deliver regularly vaccines and biological samples and other pharma items to patients, direct patients, to hospitals. Even with 12-hour shelf life, the products are manufactured at 12 midnight and deliver to the destination and get treated before 12 noon in this region. So we have strict procedures in place. So it is definitely possible if you follow a strict process and effectively. So it is definitely possible. So I do not see a challenge there. The only thing is that everyone should cooperate, I would say, the manufacturer, the airlines, the operators, and simplify procedures at destination, the importing country. So if this is done, advance permits or registrations are done, I would say that 95% KPI can be achieved.
Yeah, no, very good, very good. And Samuel, just to get a last point from yourself, you know, what would you like to see, you know, long after all of this crazy times and crazy episode is finished?
That we keep leveraging on our strength of the collaboration. I think this, like you mentioned before, this is a great industry. We all work together, and especially once the vaccine, the pandemic is gone, that conferences can happen again. That we have a beer together, have a chat again, not through a screen, but that we keep working together to enhance the world by using air cargo.
Okay. Yep. No, very good. Yep. Looking forward to that, Samuel. Okay, gents, thank you so much for joining us on the digital event. Really appreciated. Take care of yourselves. Keep doing what you're doing, and touch wood, you know, we'll be able to look back on this with a different viewpoint. And obviously, great sympathy and respect goes out to anybody that's been affected or lost any loved ones, and for all the people on the front line. Brilliant. Well done for what you're doing. Great respect.
Thank you, Chris.
Cheers, lads.
Thank you, Chris. Thank you, Chris.